once again to another podcast of Do Better.
Do better, that's right. We can do better in life, do better in a lot of things, but this is pretty powerful. This is actually the third part of my mother's CIDRAP article done by Disabled.
That's right. We're ready to give you guys another dose of very useful information.
Yes, sir. So, first part, this is the third article. It's called How to Avoid Inappropriate Dental Antibiotics. And this is something that we've been talking about the last two podcasts.
Yes.
And I've been sharing with a lot of people out there. A lot of good testimonies, people thanking me. As a matter of fact, today, when I was called the credit union to pay my bills, I mentioned my mother passed away last year. She goes, I'm sorry. Immediately came to me, be proactive. I started telling her exactly what it's about. She says, wow, I didn't know. I'm about to get my wisdom tooth pulled. I didn't know anything about these side effects. So what's it called? I say clindamycin. She goes, oh, let me look it up. She goes, oh my gosh, I'm about to spread the news. I said, thank you. It's about being proactive. So that's what we're doing today. Once again, be very proactive by giving this information.
Absolutely. So today's title is going to be how to avoid inappropriate dental antibiotics. Okay? Dentists are often prescribed antibiotics when they're not actually needed. Okay? And that creates bigger problems later on. So the problem is not antibiotics itself, is that we're taking them when it's not needed, such as, in moments when they say like, oh, just in case, for prevention, to prevent anything. You don't really need them unless if it's used as treatment.
Ask the questions. Ask the questions and ask them, as we said before, as the article will say, do I need antibiotics? Do I need this antibiotic? Can I take something else? You got to be very proactive about your life. Like this right here. I'm going to tell you why I have this on the table as an example. I have allergies and I had sinusitis. And I know being proactive means wearing a mask in windy days. We've had windy days for like 2-3 weeks now.
Yeah.
And I know that it can affect my allergies. So I wear the mask. I don't care what people think. I'm being proactive about my life. If I get allergies, it happens. But allergies can lead to sinusitis. And sinusitis can lead to prescriptions, antibiotics. If I can avoid antibiotics, I will. If I have to take them, fine. But I also prepare myself. Actually, I've been preparing myself every day because I eat the right proper foods the best I can. But if I'm going to take antibiotics, I will eat what's necessary to protect my gut. So this is why this is here, being very proactive. So the lady at the bank just told me that, and I said yes. She said, thank you for letting me know. I'm going to share this. So let's go to this. Let's go to this right now.
Yeah. Know yourself. Know your health history.
Yes.
Okay. Know what you're what's that word called? Allergic to, and what you're not allergic to.
If you're diabetic, you want to stay from sugars. If you have high blood pressure, you want to stay from salt, right? Know your body, know what you need to take and not take, what kind of foods to eat, what not to eat, healthy foods to eat. We're going to go through this. Hopefully that we were able to help you receive this, and learn from this. So it says here, if you ever had a wisdom tooth removed, you probably received an antibiotic from your dentist. Yes, they give them to us half the time. Yes. Dentists wrote 27.3 million antibiotic prescriptions last year. According to data provided exclusively to CIDRAP News, thank you, Liz Abel, by the IQVIA Institute for Human Data Science, an organization based in Parsippany, I believe it says, New Jersey, that provides research and analysis on healthcare data. Many of these antibiotics are unnecessary. In a 3-part series this week, CIDRAP News is investigating the overuse of antibiotics in dentistry. Includes changes that dentists and consumers can make to reduce the risk of harm. Although 10% to 50% of dental antibiotics prescriptions are written for people with current infections, the rest are prescribed to people before or after a dental procedure, just in case an infection develops, says Katie J. Suda, PharmD, professor of medicine at the University of Pittsburgh. Research by Suda and her colleagues found that 80% of such prevention dental antibiotics are inappropriate. Let me go back to the story of my mother. My mother was 92, very stable, still washed dishes, clean the house, would go out to get the clothes from the garage after she washed them, dried them, brought them in the house, was still ironing, picking fruit in the back, stable, was not in and out the hospital for no care, nothing like that. Very, very stable. Took the antibiotic called clindamycin. Her dentist prescribed to her. We didn't know the side effects. She was in and out of 2 hospitals with side effects. First hospital, they gave her antibiotics for colitis. They didn't check for C. diff. She had that. She took it for about a week. Family members came from different states. and we're there. A lot of us. She was never alone. I personally, you know, this. You know, when you're a little kid, that I don't know how many people have done this, but when you're scared at night, you run into your parents' bed, you jump in the bed between them because you felt safe. I did that to my mother when she was at home. The first weeks, I laid next to her in bed to make sure she knew her son was there, you know, and I was watching her. Never fell asleep, pretty much was acting like I was asleep, I guess. I was just listening to make sure that she was okay. But that's what happened to her, and then she passed away in April from the side effects of clindamycin. She caught C. diff, which is why we're trying to tell you guys about this right now, about antibiotics. We're not telling you not to take antibiotics, that's not saying. We just want you to be proactive about your life when you go see a dentist. Even a doctor. Ask your doctors the questions.
Yeah.
Obviously, we know nobody. Most people don't want to hear about the side effects of an antibiotic, right? You see it on TV. Take this, the side effects. We're like, wow, really? But I'm just speaking from experience.
Yeah. Here's a question for you. When the doctor prescribed
The dentist.
the dentist, when he prescribed, clindamycin for your mom, did she have any symptoms that were necessary?
That we mean necessary.
That were necessary for her to take.
Oh, she just had her tooth pulled, and the side effects came after she took the clindamycin.
Okay.
There's nothing there to show that she had any symptoms. No, there's no symptoms. But the symptoms came after she took the clindamycin, which was diarrhea, nausea, headaches, stuff like that.
So there was no point for her to take clindamycin then.
Well, clindamycin is usually given to you. They say if you're allergic to penicillin, so they gave it to her. And but once again, the FDA has been knowing the side effects of clindamycin for 40 years. The side effects. I'm asking why they still use it. That's what I'm saying. Why they still use clindamycin when they know it's been hurting people for 40 years. But we'll get to that. Now, clindamycin has its usefulness. I've read that too. But as a friend of mine, as we spoke, who does things in Washington, he says that he believes that clindamycin is too strong for the dentistry. So do I.
Yeah.
I think that we need to ask the questions to the dentist about what can I take? Do I need any antibiotics? Can I take Advil? I know people that told me when they're in jail, they just gave them salt and water when they pulled their tooth. And that's about it. Right? That's all they take it, some water, gargle, whatever you got to do. So the thing is, my mother was 92 and she went through a lot of pain and suffering. I was there. I saw her from 9 a.m. to 9 a.m. She was in a hospital where we could visit, stay all night. I was there from 9 a.m. to 9 a.m. My father alternated 9 a.m., 9 a.m. and I saw multiple things happening. Her pain and suffering, her headaches, her nausea. She always had a vomit bag in her hand, couldn't eat. And finally, at the end of all that, and her story, if you read it, she says, I'm done. She's internal bleeding. They want to give her blood again. She says, I want to go home to be with the Lord. I want to go home and see my 2 sons and my parents and my best friend who died from COVID at 50 years of relationship, 50-year friendship. She died from COVID. But, and it was hard to do the video that I did.
I was going to ask you about that. I saw that video and I really enjoyed it, and it's just so impactful. I mean, what was it like?
Reliving it again. Just like I did the article, I had to relive it when Ms. Zabel asked me to give information about this article. I had to go through my phone and see all the pictures of my mom in pain. Because I'm an outreach person, community activist, 40 years. I take a lot of videos and pictures. So I guess I knew someday somebody was going to see my mom's pictures in the hospital and videos of her, because this is a major issue, a major thing. So when I did the video, it was very hard. It was very hard. Obviously, I cried because I'm remembering the stories. But you know what? Like I said in the video, I would never give away. I would never delete any of this information on my phone, because we need it. Somebody needs to see it. Somebody's going to see it. And that's not just for her, but for all other people who have been affected by clindamycin. Other people that I've spoken to, professionals, have had somebody in their family have been affected by clindamycin and give them C. diff. It's crazy. I'm going to say it's crazy out there.
Yeah.
But let's go to this. So patients aren't helping by taking unneeded medications. So they said, furthermore, any antibiotic can cause serious harm, including allergic reactions. Infections with a superbug called, can't say the beginning word, difficile, or C. diff, and antimicrobial resistance is which pathogens become impervious to even powerful medications. This is a worldwide issue. Antibiotic resistance. Taking too many antibiotics, because we don't need them. Sometimes we don't need them, but we want them anyways. We take them, and then when the antibiotic where something's going on, it doesn't help anymore.
No. Okay. Guys, if the symptoms are not there anymore, stop taking it. Simply because, it's going to give you more problems that are not necessary. And this is what the article is going to talk about as we move on.
Well, Most doctors, when you get your antibiotics, they say finish the whole bottle.
Yeah.
I know that people who have not taken the whole bottle, they're well. That's your choice. That's your own personal choice. I'm not saying don't do it. I'm saying...
Yeah, as a matter of fact, I had a bite on my leg. Okay, a spider bit me, and I had to take some antibiotics for that too. And as soon as the bite was gone, as soon as it was the swelling was gone, and it was finally just not less painful, I stopped taking it. I still had like maybe 10 more antibiotics in the bottle, but I was like, no, I don't need it. After reading this and learning about this, I'm okay.
Well, once again, we're not doctors, but we're telling you from personal experience is that when you take antibiotics, if you're going to take antibiotics, that's your choice, but not against antibiotics.
No.
Ask your doctor what's the best. Should I take them all or not? That's your choice.
Yes.
If I'm going to tell you to take the whole bottle, then it's your choice to do what you want to do. We're not saying don't do it.
Yeah.
The more we use any antibiotic, the less effective it becomes. The more we use antibiotics, the less effective it becomes, said Deborah Goff, PharmD, a professor of pharmacy practice at the Ohio State University College of Pharmacy and an infectious disease specialist at Ohio State's Wexner Medical Center. People can take a number of steps to avoid being exposed to inappropriate antibiotics, experts say. To be exposed, again, people can take a number of steps to avoid being exposed to inappropriate antibiotics, experts say. Well, ask the questions.
Okay.
Do I need that antibiotic? Do I need it? Or can I go take some lemon and tea? Right? Can I do something else that I can get to heal? Instead, the thing is where I learned from experience. I know nothing about this stuff.
Yeah.
Until I went to Liz Abel and she did this great article, and I'm reading this stuff like, wow. I mean, I was just like that too. Give me antibiotics. Give me antibiotics. I was the same way like that. Boom, boom. But I didn't think about antibiotic resistance. It said someday, maybe, I don't know, maybe my body, I'm going to take antibiotics, it's not going to work anymore because I've been taking them so much.
Yeah.
Never thought about that. But now I think about it a lot. Once again, sinusitis, I didn't want to take the antibiotics at all. Believe me, I did at all. But it came to a point where I really needed them. But I took them. But once again, I'm still a person who eats some kind of food. So I started downing my yogurts, my sauerkrauts, like I always eat, just to protect my gut. And I'm good. I'm good. So this is something that, we're trying to teach you guys. Hopefully you're listening and we'll learn this. So go ahead.
Yeah, so absolutely. People think antibiotics are like candy, but they're not. You get allergic reactions, stomach issues, serious intestinal infections, medication complications, and you really don't want all that.
Yeah, so ask the question. We're not against it, but ask the questions. Go ahead, BG. Keep your mouth healthy.
Okay, keep your mouth healthy, okay? As we're written here in the article, that section where it says that, okay? Maintaining good oral health helps to prevent dental infections. If you develop pain or swelling in your mouth, call a dentist right away. With early treatment, many patients don't need antibiotics, said Erin Kennedy, DDS, MPH, a board member of the Association for Dental Safety.
Read that again, please.
Okay, from the very beginning?
Yes, sir.
Okay. Maintaining good oral health helps to prevent dental infections. If you develop pain or swelling in your mouth, call a dentist right away. With early treatment, many patients don't need antibiotics, said Erin Kennedy, DDS, MPH, a board member of the Association for Dental Safety.
So how do you keep your mouth healthy? Well, we were taught this a long time ago. Brush your teeth before you go to bed. Brush your teeth in the morning.
After
brush
you
your
eat.
teeth after your meals, which how many of us do that, right?
Yeah.
I do see some people, they're doing it all the time. I remember that they came up with these little things that you put on your finger, you can do all this.
Oh.
They came up with the whole point is they came up with them. That was help. That was like after you eat, you just water, whatever. But the whole point is that's part of keeping your mouth healthy, right? Is brushing your teeth twice a day and after you eat. Yeah. I learned this a long time ago. Was I doing it? Not today, yes. Through the day, no. But now, oh yeah. I even got two different kind of toothpaste I use.
Yeah,
I do because what happened to my mother, not the fact that it was because of she didn't brush her teeth, whatever. But we all go through some kind of dental issues, right? But I've learned now to try to keep my mouth healthy every day. So after I maybe drink a coffee, I'll brush it. I eat something sweet, I'll brush it. Matter of fact, I plan to go, and I haven't done it yet, to go buy my own little kit. Toothpaste, water, everything. So carry my car. So whatever I got to do, because I need to be, it's being proactive about our life. We got to be proactive about our life, and even not just dentists, but life in general. Be proactive. Like I said, you're diabetic, stay away from the sugars. High blood sugar, stay away from the salt. All that stuff, stay away from it. Come on, guys, don't pop pills and think, oh, I'm covered now. Which we do that. They'll pop the pill and go sugar, whatever, because they feel that that pill is going to protect them. How about just change our diets? How about be proactive, change our diets? That works too. Just think about your life. Some people, just be real, kids, you have kids, family, wives. We think about that stuff when we're sick right now. How about being proactive in the beginning?
Yeah.
Eat differently. I know it's hard to change your diet. It's very hard to change your diet. We're so used to sugars and salts. How about start working on some bland stuff? Not so much sugar and salt. I personally make salmon with lemon. I put lemon on it. If I do salt, I do a pinch. That's it. Most of it's lemon on my fish because I try away from that stuff. My last blood pressure check, I'll tell you, 123 over 70 something. 2 weeks ago, 123. I'm 60 years old.
Wow. You look great for 60
123. I changed my diet. I ride my bike. Ate a lot of beets. That's just me. That's just me. I'm not saying you can eat beets because that's part of your diet, your health, whatever. But I'm a beet lover. So, anyways,
there's a lot of potential, guys, for your health.
Yes.
I admire you because you're maximizing the potential of your health, and I feel like I gotta do that too. All right, so allow me to continue with the article. All right, don't pressure your health care provider for antibiotics. Okay, research shows that most people who undergo dental procedures who experience pain and swelling don't need antibiotics, said Kennedy, okay, who is also Assistant Dean of Curriculum and Learning at Kansas City College of Dental Medicine in Missouri. That evidence has led medical and dental societies to recommend them only for people with very specific health conditions or who have compromised immune systems. Okay?
The American Dental Association recommends antibiotics for people with tooth pain who also have a fever, chills, or other signs of symptomatic infection. Okay, I understand that. Those affecting multiple organ systems. Although the best way to cure a dental infection is to immediately treat the tooth, such as by performing a root canal, as the lady she was saying, which she told me in the bank, or extraction. ADA guidelines state that antibiotics may be inappropriate for patients who can't have definitive treatment right away in order to prevent a localized infection from spreading, Kennedy said. The American Heart Association used to recommend prevention antibiotics before invasive dental procedures for people with a variety of the heart conditions. Cardiologists were concerned about the very small risk that oral bacteria might travel, I understand it, to the heart and cause infective endocarditis, an inflation of the lining of the heart or valves in people undergoing such procedures, said Walter Wilson, MD, an infectious disease specialist at the Mayo Clinic in Rochester, Minnesota. That was something they asked my mom. That was one of the questions that I was asking my mother. My mother never had a heart transplant, never had no fake knees or no knees, whatever, nothing like that. She never had no knee issues or heart issues. And that was one of the questions when in the investigation was they asked because those things are worse. And no, mother was very healthy for 92 years old, very, 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 very stable. I used to take vacation to go to the grocery store here on Wednesdays, and I had videos of her walking to the store, walking, not on a cane, not in a car, not limping, just gone. Wow. I had to turn around, she's gone. Mom, I'm in the meat department. 92 years old. Very, very. My mom was back in the days where, and some of you might understand this. Well, you bump your head. Oh, go drink some 7-Up, go lay down. Mother's like that, very, very strong. That's where she came from. Born in 32.
Wow. Back
then, where nobody thought about, or even I won't say thought about it, but when you got hurt, it's like, okay, go put some Vicks on. That's the kind of stuff she came from. So her being that type of way, in 92, she showed it all her life, very, very strong. But this right here, this clindamycin, took my mom out. I've never seen her so weak, and afraid. She was afraid one night. She woke up. I was in the hospital, I think about 4 in the morning. Never seen my mom afraid, ever. And she said, "Are you here?" "I'm here, Mom. I'm here, Mom." I said, "Mama." I never called her Mom. I always said, "Madre." See you later, Madre. See you later. I never said goodbye. I always said, "See you later," because I never went.
Mm-hmm.
Goodbye is like, I'll see you again sometime. Because I always see you later. Because I'll see you later. Goodbye was to me was like, just the last time I'm ever going to see you. So I never called her mama until that night. And after it happened, everything was mama. I don't know why. We probably resorted back to mama. Even when she passed away in the back room, I told her, Mama, I whispered in her ear, I said, where he is, you will be also. And I said, Mama, I will see you later. And that is painful for me. But that's why we're here now.
Yeah.
We don't want, and Gabriel don't want, family, want anybody to go through what we went through, which is why we're being proactive. This is not about just telling my mom a story. This is to save families, destroy family could be destroyed, pain and suffering, all the stuff you can go through with this clindamycin. And instead it has good stuff about it too, but any antibiotic, when you take antibiotics, can affect you. Just be very proactive. And one of the biggest things is understanding, asking questions, and eating properly. Change your diet. But anyway, go ahead.
Absolutely. Today, Wilson said that the AHA recommends preventative antibiotics only for specific patients. Okay, number one, people who have received an artificial heart valve or valve repair with artificial material. Okay, those who previously had infected endocarditis. Okay, that's the second type of person. The third type of patient is patients with cyanotic
congenital heart disease.
Congenital heart disease, a condition in which one or more structural problems with the heart's chambers, valves, or blood vessels are present at birth.
Yeah.
Okay. The fourth kind is people who have had a heart transplant with valve disease.
Yeah, that's a question today, my mama.
Okay. Those four specific conditions put dental patients at the highest risk of death or severe illness from infected endocarditis. Okay, in its 2021 guidelines, the AHA singled out clindamycin as an antibiotic to avoid. Okay. Wow. Okay. To avoid.
Okay, it says, ask if antibiotics are truly needed. This is what we've been saying about the antibiotics. Ask the questions. If your dentist suggests clindamycin, it didn't say any other name, it said clindamycin, which has a high risk of causing C. difficile infections. They've been known for 40 years, the FDA, 40 years. Ask for a different antibiotic, said Amesh Adaja, MD, an infectious disease physician, critical care expert, and senior scholar at the Johns Hopkins Center for Health Security. C. difficile infections, which cause severe diarrhea, that's my mama, can be life-threatening. But other antibiotics should be questioned as well, yes. Anytime a dentist wants to give you an antibiotic, ask, do I really need this? Adaja said, do I really need the antibiotic? Especially if they offer you clindamycin. Red flag.
Mm-hmm.
Last podcast we did, a good friend was here.
And
he said he went to get his tooth pulled, and they offered him clindamycin, and he went, red flag. Is there anything else I can have? They gave him something else. He said immediately he remembered what I was talking about. He remembered me being proactive. He remembered me seeing these articles to all my friends. Look at.
Mm-hmm.
He remembered that, and he came out well. He asked the questions, proactive about his life, and that's how we have to be proactive about our life. So when you go to the dentist, ask the questions. If they say clindamycin, remember what we spoke about today. Mm-hmm. Okay, ask the question, do I need that clindamycin? Is there something else that I could use? Is there something different? Because if you don't need clindamycin, don't take it. Don't just let them give it to you because they say, hey, this is no. Ask the questions.
Yeah. Okay. Do you want to...
Ask about side effects and warnings sometimes.
Okay. So if a dentist suggests an antibiotic, ask about its typical side effects. Okay, said Kevin C. Lee, MD, DDS, Assistant Professor of Oral and Maxillofacial Surgery at the University of Washington Harborview Medical Center. While all drugs have side effects, if you're concerned about a particular antibiotic side effects, your dentist may be able to prescribe an alternative.
That's what they do with Anthony.
Yep, exactly. Additional questions to ask include which side effects are normal, which side effects might be might signal a serious complication. Under which circumstances should I call you? How can I reach you after hours? When should I contact a medical doctor or go to the emergency department? Those are really good questions that you need to ask.
If you go to Dolores Owens, DOLORES Owens, once again, DOLORES Owens, clindamycin, this article will pull up. There's 3 articles. This is the 3rd one. It'll pull up, and everything we're reading here, you can read for yourself. And it says, anytime a dentist wants to give you an antibiotic, ask, do I really need this? Anytime a dentist wants to give you an antibiotic, ask, do I really need this? Many people taking antibiotics experience mild diarrhea and stomach upset. Many people taking antibiotics experience mild diarrhea and stomach upset. But stomach pain, cramps, and 3 or more episodes of watery diarrhea a day can be very early symptoms of C. difficile infections. My mama had that. We didn't know. My brother's taking the same antibiotic before, and we didn't know the side effects of it. She called him and said, "I've been having problems," so immediately she got off it. We didn't know this. We didn't know. I never even heard of this. I know a nurse that told me last year, as my woman died away. I've been a nurse for years. I never heard of C. difficile.
She never
heard about that stuff. She's a nurse. She never knew about that stuff.
Wow.
It's going on. It's going on a lot. Investigate.
Yeah.
Contact your dentist or doctor right away if you had these symptoms, Lee said.
Okay.
Contact your dentist or doctor right away if you had these symptoms, Lee said.
Yes, absolutely. Okay. And also share your medical history with your dentist.
Yes.
This one's very crucial, you guys. Okay. Tell your dentist if you previously had a C. difficile infection or severe diarrhea after taking an antibiotic, Kennedy said. People who had C. difficile infections before are more likely to get them again. Okay. Oh my gosh.
Yes. That's. I spoke to a professional, and looked at the concerns.
Yes.
Once you have it, you may just get it again.
Yeah, absolutely.
That's horrible. I mean, I even read where you can take clindamycin, not have the side effects now, and months later get it. Am I wrong about that? So please, if you want to respond to it and tell me, read it.
People with possible penicillin allergies can get a different answer by seeing an allergist, said Kennedy. So guys, if you're not 100% sure if you have allergies, check with an allergist. Okay? If the allergy test is negative, people should talk to their doctor and their dentist about updating their medical record to remove penicillin from their list of allergies.
Many people assume they're allergic to an antibiotic because they developed nausea or diarrhea in the past, Adagio said. While these are unpleasant side effects, they're not allergic reactions. Guys, we just want to, once again, inform you what's going on and hope you guys that you're blessed and that, once again, you can go online and check these articles out. Gabriel, thank you, man.
Thank you, Robert.
Thank you.
It's an honor.
We'll see you guys next time and do better.
We'll see you guys next time. Sure.